So if you're a school-based counselor or really any counselor and you find yourself sitting with a kid that you believe has obsessive compulsive disorder, or you're working with a kid that you know has obsessive compulsive disorder, what we're going to do today is give you the 6 things that I would work with this kid to reduce doing or stop doing altogether that will have significant impact on their OCD and on their mental health in general. So stick tuned. What we're going to be talking about today is OCD, what to do about it, and how to help kids perform at school who have OCD. My name is Ira Hays. I'm a therapist specializing in the treatment of anxiety disorders like school phobia, emetophobia, agoraphobia, and of course, obsessive compulsive disorder, which we'll be talking about today. I have an emphasis in my career in the intersectionality between mental health and education. And this video is part of a series of videos that I have created to help fill in a gap of knowledge in the relationship between different mental health concerns and school attendance. For those of you who don't know me, I've been training schools for the last several years on how to deal with school phobia, school avoidance, and school refusal. So as mentioned earlier in the video, today we're going to be talking about 6 things that I would do for a kid with obsessive compulsive disorder if I was meeting with that kid at a school-based program. The first one is I would understand that these 6 things are part of any treatment plan for a kid or an adult with obsessive compulsive disorder. Reducing these 6 things is going to help improve a kid's mental health and help improve their obsessive compulsive disorder. Many of them are going to be shocking to the kids that you're talking to. They're going to be confused about how they may not even understand how these things are related to their obsessive compulsive disorder. And some of them may have good insight into how these things relate to their obsessive compulsive disorder. But the goal of treatment, we are doing exposure response prevention for obsessive compulsive disorder and acceptance equipment therapy that we talked about in the last video. But in general, even if a kid's not doing any kind of exposure plan, these 6 things will, if we help them reduce it, will help them gain mastery of the rules of obsessive compulsive disorder in their life. And that's very often how I frame it with the kids that I'm working with. I often, to get to these rules, I often ask kids, hey, what are the rules that you have to live by that your obsessive compulsive disorder provides to you? So the first one is going to be ruling out any use of substance use. So substance use we see in the field of mental health as an issue on its own, but when we talk about obsessive compulsive disorder and substance use, we also see it as kind of a distraction technique and a way of numbing unhealthy thoughts. And you're going to see a theme that a lot of these things that we ask kids to do are things that prevent us from facing the obsessive compulsive disorder and the intrusive thoughts. So we'll talk a little bit more about that. So first one, number one, is substance abuse. The second one that I like to talk about is doing research. So very often kids who present with maybe some kind of medical concerns related to their obsessive compulsive disorder, or they have some health concerns or contamination concerns, will do excessive research as a way of mitigating the anxiety they experience related to their obsession. So they might have some obsessive thoughts about, will I get sick from this? Or will something happen to me if I do this? And then they'll go and do research. And as they do research, they find that their anxiety drops a little bit, and that research becomes one of the compulsive behaviors. So we're going to help them understand that connection and limit the amount of research they do in this area. Number three, so the third one that we're going to be talking about is reassurance. And we talked a little bit about reassurance in the last video. Oftentimes, reassurance comes as its own theme, but also it kind of piggybacks on other themes. So you'll notice that kids will seek reassurance about, do you love me? Or am I going to be okay? Or am I going to pass this class, or am I a good person? Very often they have moral implications of these unanswerable questions that people seek reassurance for. So we're going to ask kiddos to stop seeking reassurance. There's a lot of different ways to do this. We'll probably have a video in the future about specific ways and interventions to reduce reassurance, but the goal is to collaborate with them on a plan. None of them have to be like stopping things cold turkey. So we don't have to stop reassurance cold turkey. We might reduce slowly the amount of times that we're seeking reassurance. Or if you watch our last video, there's some other ways, like we might reduce the amount of time that people can seek reassurance, or we might reduce the themes around the reassurance seeking that they're doing. In any event, the third thing that we would do is reduce reassurance seeking. The fourth thing that we're going to ask people to stop doing is going to be a tough one, but we're going to have them stop using distractions. So when someone is having obsessive compulsive thought or an intrusive thought of something, very frequently people around them, particularly ones that are trained in other evidence-based things for other things other than OCD, they'll use distraction as a technique to get that intrusive thought off their mind. But with obsessive compulsive disorder, we know that when we distract ourselves from an obsessive thought, it actually perpetuates that thought moving forward in our life. So we might distract ourselves and get reinforced for that distraction by a temporary lowering of anxiety, but it perpetuates the OCD and builds it up and makes us want to distract more. Now, there's a lot of common distractions, and I think there's a lot of interplay between social media and our cell phones as a distraction technique. And I do see a lot of kids with obsessive compulsive disorder spending a lot of time on their phone, on social media, and on group chats as a distraction technique to mitigate their anxiety. So we want to really get control of how often we're using distraction. Distraction can also be watching movies or excessive exercising or anything else that will draw our attention away from the intrusive thought and to this other distractive activity. The fifth thing that we're going to talk about not doing with our students who have obsessive compulsive disorder is avoidance. And we talk a lot about avoidance on this channel and how it interacts with anxiety, but particularly with obsessive compulsive disorder, avoidance can be a tough one. So I think in the last video, we used the example of a kid having an intrusive thought of maybe pushing a friend in front of a bus or harming someone. And we might avoid that bus ride or avoid that friend, right? But we might also avoid touching things that we think might be contaminated. Avoidance might be why they're not attending school in the first place and how it's associated with their obsessive compulsive disorder. So, for example, if they're having intrusive thoughts of, let's say, you know, being attacked while at school and they just can't get that thought out of their head. They might start with avoiding a particular room or a particular place in the school, but then the avoidance grows and grows related to those intrusive thoughts. And now they're refusing to come to school, or they're refusing to go to the grocery store, or refusing to go anywhere where they might see someone where they might have an intrusive thought about that person attacking them. So the fifth thing we talked about is reducing avoidance. And the final, sixth, and last thing that we're going to ask kids with obsessive compulsive disorder to either stop or reduce is fulfilling their compulsions. So if you have kids with, let's say, symmetry OCD or reassurance OCD or any kind of OCD where there's a compulsion where we either see it or we don't see it, we're going to ask them to stop fulfilling that compulsion. So, for example, if we have a student who has symmetry OCD and they notice that every time they put their right hand down on the desk and go to write, they also have to then put their left hand down in a similar way to make sure it feels right. We're going to ask them to stop fulfilling that. We're going to have them sit with that discomfort for a while. We're going to make sure that they know and recognize that the more they fulfill that compulsion, the more they're feeding the anxiety. So, those are the six things that we're going to help students reduce. We're going to help them reduce the use of substances. We're going to help them reduce research. We're going to help them reduce reassurance. We're going to help them reduce distraction. We're going to help them reduce avoidance. And we're going to help them reduce the amount of times they're fulfilling compulsions. And when we successfully help kids reduce these six things, whether we're set up building a fear hierarchy or not and doing specific exposures, we're helping them kind of gain back ground from their OCD and from their anxiety. We're helping them gain a presence of healthiness rather than giving up space to their anxiety. So, if you're interested in OCD treatment and how to do that as a school based clinician, I recommend that you, if you haven't, you watch part one of this, which should have been attached earlier on in the video. And if you're interested in school attendance in general, I would take the time to watch this entire playlist where we talk about emetophobia and agoraphobia and school refusal and all the other reasons why kids are not attending school right now. If you like this video, please do me a favor and leave a comment, leave what you liked about it. If you have a disagreement with something I said, feel free to leave that too so that I can gain more information about what you guys need and what you're seeing in the schools that you're working in. Also, consider subscribing to the channel. It'll help you also get notifications on new videos that I'm dropping every Monday regarding school attendance and mental health and education. So thanks so much for watching. I'm sure it's making a recommendation for a video that's picked specifically for you. Thanks for watching. Appreciate it. Hope to see you again soon.